So kennel cough is a disease dogs transfer to each other, so it's highly contagious. So this little puppy can give the Bordetella bronchoseptica. It's like whooping cough that people get, and they can give it to the next dog. So, but the other part is that most adult dogs will just get a real mild cough and it'll go away. But if the dog doesn't have a good reserve, it might get real sick. So you don't want to be around a puppy that's coughing like this. And shelter dogs will real commonly have it because they come from a real stressful situation. They get a pretty good dose of it and they end up getting sick. But so if you have a dog that's coughing like that, please tell your veterinarian and they'll probably keep you isolated, and tell friends that may come over and visit you that your puppy's coughing and it might transmit it to their dogs. There is a shot, Bordetella, which you can give a dog once or twice yearly, which will prevent it or make the signs very minimal. So this is Bordetella bronchoseptica in dogs, or kennel cough. That's not vomiting. That's kennel cough. And kennel cough sounds just like that.
Good dog.
And that can be caused from allergies, but most likely it's from the exposure to Bordetella. This little guy just was in the shelter, he just had surgery, he had vaccines, and now he's sick with the kennel cough because his his reserves way down. And it makes them, their tonsils go way up, they have a tonsillitis, sore throat, and a terrible cough. A lot of people think that's vomiting, but that's not vomiting, is it? That's kennel cough. So what you do is your veterinarian has drugs they can give them. Doxycycline is what we use, or Clavamox. I like doxycycline. And you can go to the drugstore and you can get Robitussin Dm, children's Robitussin. Remember, DM, dog medicine. What do you think, dog?
Just for comparison, this is a dog that's got an asthma heart cough. And dogs like this just generally have kind of they sound like you have a mucousy cough, but they don't have the gag at the end, like the like the one you heard from the other dog. They just have a kind of a constant cough. So this one, you can be asthma in dogs, or it can be a heart cough. So I thought I'd throw that in there to just show you what that might sound like. So you can use Robitussin Dm for dogs. You can use a cc per 10 pounds, and each teaspoon has 5 cc's. So a teaspoon would be enough for a 50-pound dog, 2 teaspoons for a 100-pound dog, and only a little bit of a teaspoon for a 10-pound or a 5-pound dog. So you can calculate that out. You can also use Benadryl. It's 1 milligram per pound. Benadryl without the decongestant, pseudoephedrine. You can give that to dogs, 25 milligram adult. Benadryl would be good for a 25-pounder. 5 milligram children's dose you can give to a 5-pounder. So you've got to see how many milligrams it has in it, and it's 1 milligram per pound. You can also use a low-dose aspirin, an 81 milligram. You can give half of one to a 5-pound dog. You can give a whole one to a 10-pound dog. And an adult aspirin you can give to a 30 to 60-pound dog. Don't use Tylenol. Don't use ibuprofens for dogs. They're not as safe. So kennel cough is prevented with a vaccine, or at least made minor or made less severe. But it always doesn't prevent it. But it's required for grooming. It's required for kennels. And it's a good idea if your dog's out and about all the time. I've cut back on a lot of vaccines. We've gone to every 3 years for distemper, parvo, and rabies, and distemper probably doesn't even need to be given for older dogs. So I hope that makes sense, and you got the differences between the different coughs. Um, Reverse sneezing and tracheal collapse, I have videos on that. Reverse sneezing is, and that can be due to allergies. Pollens and molds can cause that, and you can also use Benadryl for that. Tracheal collapse can be brought on by allergies. A lot of dogs with asthma or bronchitis can have tracheal collapse. And that coughing and gagging that you saw, that kennel cough, that can also just be an allergic bronchitis. But most commonly it is kennel cough. But if your dog got a whole bunch of pollens and molds in his throat or sneezed in some irritating substance, it might do the reverse sneeze, and it might do the bronchitis cough. So I hope you don't have to hear any of those coughs at your house. But if you do, at least you might know what they are. So check out the other videos, the reverse sneezing and the collapsing trachea, and I might even have one on laryngeal paralysis in dogs. If I don't, I better make one. You have a great day.